Well, see the list of all of her titles and expertise.
I know.
Yes, why I said she will introduce herself. Welcome, Dr. Beatrice Wiafe Adai.
Thank you so much. And I want to say a very big thank you to the organizers who have been doing so great, because it wasn't easy to get me over here. And I also want to thank Reverend Dr. Tuma for visiting our hospital last month. Thank you. She's a board member of our board of directors. Ricky Ferry has visited Ghana on 2 occasions. We celebrated the World Cancer Day 2025.
Doctor is in with
and
Dr.
Walk for
Beatrice.
the Cure. My brother Phil, thank you. We met again here, he's Ghanaian. When we met with the Links ladies, the president, the executive, and Ricky was there, and Mariko, and we met again, and he said he will come to support this event. So thank you. And my son, Kofi, who has been escorting the mother. Okay, I'll try. So cancer is a global problem. And I mean, we heard about what's happening in the US and in most high-income countries. You have the screening mammogram, you do genetic testing, you do so many things. But I wanted to bring your minds to Ghana, and like a low and middle income country where we don't have screening mammography, but we don't have any social support systems. So when the woman gets breast cancer, it's between a family involved. As far back as 2002, the research that WHO did came out to say that cancers are killing more people than HIV/AIDS, tuberculosis, and malaria combined. And why is the attention on malaria, HIV/AIDS, tuberculosis, and the communicable diseases? It's important. But we shouldn't forget that we'll be done with the communicable diseases, but the cancers and the non-communicable diseases will still be with us. There was a question about men. Men also do get breast cancer, but they are in the minority. And what we also say is that every man has a woman in his life. And that is the mother, the sister, the daughter, the wife. So when it affects the woman, it affects the man as well. In fact, you see how men do feel when their mothers are diagnosed with breast cancer. So men cannot say they are not part of the problem and the answers. In Ghana, the population of 35 million, every year more than 27,000 people are diagnosed with one cancer or the other. And breast cancer is the most common cancer. Please forgive me, I'll be showing some graphic, pictures, but that is what happens. Sometimes we have to say it as it is. And this was a 28-year-old lady who came with a 2-year-old daughter. Her problem was the fact that the milk had stopped coming from the left breast, not the wound on the right one, because the cancer had eaten off the right breast. And a disease that does not start with pain, and people think once there's no pain, there's no danger. They think that breast cancer is not curable. I mean, we still don't know the cause of the disease, so we cannot do primary prevention. And in our set, and I think a lot of Black women, we are very superstitious, very religious, and so when there's no cause, we must apportion the blame to someone. The blame is always put on the witch. So they think it's by faith, caused by witchcraft, the woman's fault, the result of a curse on a family, especially when you have 3, 4, 5 people in one family developing breast cancer. Not to think of maybe a genetic mutation that is causing the problem. And because of all these, breast cancer is still stigmatized in our part of the world. Women have a lot of barriers to overcome when diagnosed with the disease. And this was a 31-year-old, also came with one child, 6 months old, and the tumor was so huge. The women have to overcome this lack of awareness, inadequate or bad treatment, the cost involved, the distance they have to travel from their villages to the cities, lack of counseling, lack of support, and we have a lot of men divorcing their wives when they are diagnosed with breast cancer. Poverty, fear, stigma. So we can see a male patient on the screen. The 13-year-old girl was diagnosed with phyllodes, intermediate phyllodes, and phyllodes is a type of breast cancer that people think is so rare, but we are getting quite a number in a year. At the age of 13, she had to lose both breasts. And when the disease stays so long, that's when we get the stage 4. It can spread to the brain, the liver, the lungs, or the bones. And about 60 to 70% of our patients come with either stage 3 or 4. And I love this quote, that our lives begin to end the day we become silent about things that matter. That's why in 2002, we formed the Breast Care International and the Peace and Love Hospitals to create awareness about the disease, to improve diagnosis and treatment, to increase survival rates, reduce morbidity and mortality, establish our own data. In fact, we are talking about the disparities that is occurring here. We have a lack of even a registry. We don't have a cancer registry. So if we are talking about it, it's like we see more malaria than cancer. We see more tuberculosis. So what are you talking about? But we are saying that this disease is no more a matter of public health concern. It's a developmental issue. It's an economic issue. And we needed to try to train manpower in oncology. We don't have any basic nursing school that trains nurse oncologists. So we had to train those, especially in the communities, to fundraise to support the needy patients and to use the breast cancer platform to create awareness about the other cancers like prostate cancer, cervical cancer, liver cancers, which are very common, and to engage in research. It's only through research that we can find the etiology of breast cancer. It's only through research that we can be able to say why we, the Blacks, are getting a lot of triple negative disease, which is more difficult to treat. And so if your women are getting more triple negative disease and they are coming late, obviously your mortality is going to be high. But we need to bring down the mortality. So we have to model that we use. Breast Care International looks at the healthier community, and Peace and Love Hospitals see the sick people, work on survivorship. And we have the CALSA, which is the Peace and Love Survivors Association. They're about 1,000 in their data now. Our approach is through advocacy, communities, the schools. Here, and I'm happy I'm in a school. I was just telling Phil, next week we are going to a school with a population of about 4,000 students. We go to them, we educate them, and we screen them. By screening them, they also learn how to examine themselves. And we believe that they will help us to educate their mothers, their grandmothers, their aunties. And by the time they grow up, they wouldn't believe that breast cancer is caused by witchcraft. Capacity training, capacity building, and the training and education, donation of essential medicines. We're fortunate to partner with Direct Relief an NGO based in California, brings us drugs and medications and equipment for community-based clinics and hospitals. Patient support, survivorship, and the work for the cure that we do every year. And let me invite you to the walk this October. It's on the 10th of October. And if your time will allow, come, let's work together. Let's showcase survivorship and let's create more awareness. We realized that we needed to travel to the communities. Some places you go and you don't even have an air-conditioned room like this to gather people. We have to create our own shelter and gather the women to educate them and put them down to screen to check if they have something that they don't even know. And we believe that with the children, the youth, will be able to work towards a breast cancer-free future. We also take advantage of events like Mother's Day, Independence Day. We gather women, and this Mother's Day, we are also going to have another big event. So the advocacy takes us to various places. And the training that we did, we normally do for our doctors, physician assistants, nurse practitioners, those in the communities, to give them the information on how to even identify breast cancer at the beginning and know when to refer them. So the nurses, community breast health volunteers, those are the Presbyterian Ministers' Spouses Association. You know, in any church, the pastor's wife happens to be the one the women approach when they have any problem with the breast and maybe with the cervix or the other parts of the body. So they also needed to be trained. We have the PNS navigators, the survivors who have been trained as navigators, and also the young ambassadors who are the senior high school students. We educate through the media because the media should always be an integral part of our activities. They carry the message to the people. So that is PALSA. And they were formed to improve the quality of life of breast cancer survivors, to have the sisterhood and to stand for each other, to seek to bring them together and to help demystify breast cancer and remove the fear that normally surrounds the disease. So we have survivors who are empowered and they are able to come out, show their scars, show their prosthesis for women to understand that with or without your breast, you are still a woman. And you can do whatever you need to do for your family and for your children. So this is one of the survivors. That was the first day in the hospital, 2012. And now she is a member of our staff. We've employed 5 breast cancer survivors who work as peer navigators, picking the newly diagnosed and walking them through the journey. So that's one I showed earlier. That is her present picture when she, she came to show herself that this is then and this is now. By all means, we will all die, but we should die in dignity. So the 13-year-old post bilateral mastectomy, she is now 20 years old. 2 years ago, she became pregnant. She didn't even know. And she complained of abdominal pains. The parents took her to hospital and realized she was in labor. That's when she started talking. It's a senior from a tertiary institution in their small town had been sending her to go and buy Coke. And she has been drinking it. She didn't even know what the guy was doing with her body until she became pregnant. And that is one of them. And she is now also with the team doing outreach programs. So we are saying that even though we are seeing our patients late, as long as they don't have distance metastasis, they can be cured. So locally advanced breast cancer is something that we meet very often. And after going around educating them, survivors sharing their story, see every woman now wants to be screened. So in case we had screening mammography, our women would want to have it. And because we don't have it, we have to put every woman down and do what we call clinical breast examination, using what we have, that is our hands. So we've trained a lot of nurses who go out with us to do the education. Phil will see our late former president, our former president, who is a patron to us. These are the two occasions I was invited to the White House by Ambassador Nancy Brinker, and I'm so grateful for all these opportunities. We realized that we should make a conscious effort to involve everybody, presidents, vice presidents, first ladies, the youth, the media, men, women, everybody, because breast cancer is no respecter of persons. And opinion leaders should also not be left out. So, like I mentioned, every October we walk. The highest number we got was in 2019, when we had more than 43,000 people coming to work for the cure. That was right before the COVID. Last year, we had about 30,000 people working for the cure.
I was there. It was really cool.
Yes. Ridiculous. So in 2022, we launched the first ever Lancet Oncology Commission's report on Sub-Saharan Africa in Ghana. And this was hosted by Breast Care International. At the time, we had our present vice president, the lady, our first female vice president, and our chief of staff, with our former first lady, our former minister of health, together to join us. I mentioned that breast cancer does not discriminate. So whether you are in party A or B, you should be involved when it comes to cancer, the discussion about cancers. And according to the Lancet Oncology report, we've seen too many reports, too many words, too many good intentions, too many families torn apart, and too many excruciatingly painful deaths to see yet more delays in taking collective action to accelerate cancer control in sub-Saharan Africa. Right after the launch, some of us came together that sometimes we launch reports and they end up on the tables, on the shelves. We do nothing about it. And so Professor Wolungwa was in Harvard and came to Johns Hopkins. Professor Stephen Avery of UPenn, Professor Saiful Haq of University of Pittsburgh, Bishop Dr. Evans Grover, who is the chairman of the board of directors. This is Theodosia Jackson, who's also the chairman of BCI Center Hospital. We decided to establish the first ever standalone comprehensive cancer center of excellence in Ghana. And to name it after the king. We want it to be a sustainable project. Sometimes when a party is involved in creating something, when the party goes off, that project also dies off with them. So we didn't want it to be a political project. So we approached the king, presented the project to him, and he was so glad that we were going to do something about cancer in our country. So he gave his blessings. We had acquired a 52-acre plot of land, and this land has been donated to the project. We decided to phase out the project because it's going to cost about 100 million, but we decided to tackle the first phase at the cost of $10 million US. So in 2024, October, we cut the sword for the project to start. And this project is going to have the prevention and awareness wing, screening, research, training and education, diagnostics, pathology, surgery, chemotherapy, radiotherapy, immunotherapy, palliative care, and rehabilitation, survivorship, and an AI hub. With a population of 35 million, we have, I can say, 2.5 radiotherapy centers, because one of them is almost always not working. So ideally, we are supposed to have 1 radiotherapy machine to 1 million population. And so see the disparity. A lot of patients have to wait for so many months before it gets to their turn. But we believe this will change very soon. Now I want to touch on this research. There are new technologies for global health tissue diagnosis. So what we are saying is that we can now drink wine without the glass. So with UC Davis, Professor Richard Levinson, University of Washington, Seattle, and the Peace and Love Hospital, the first ever core-view instrument has been established in the Peace and Love Hospital in Kumasi. It's the first of its kind in the world. It's supposed to be used for the low and middle income countries and the hard to reach areas in the high income countries as well. So this equipment is able to generate an image from a core biopsy. So this is the biopsy room. You put the woman there, you pick the biopsy, you put it in the machine, it generates the image, and pathologists from UC Davis or University of Washington, or any pathologist who has access to the equipment can give you the report within 5 minutes. So the first test we did took us 10 minutes to get the report. This is against the 6 months wait that sometimes the woman has to wait for her biopsy report. And imagine the stress that the woman and the family go through whilst waiting for their reports. So this is something that we believe is going to change the narrative about cancers in Africa and in the world as well. So these are collaborators, and we see Sambai here. Sambai's project is going to actually solve a lot of problems for us, because in the high-income countries, at least a lot has been done. But in the low and middle-income countries, we need to do quite a lot to study the genetics, to study the exposomes, to study our environmental factors, to also increase survivorship, and to see what we can do to improve or reduce the number of women, our loved ones. And I always say that when we mention the number of women dying, for example, in Ghana, every year, we have more than 2,300 women dying from breast cancer. It's not up to the number of women who died from COVID for 2 years. But every year, more than 2,300 women, Ghanaian women, die from breast cancer. These are human beings. These are loved ones. They are not just figures. And so we all need to do what it takes for us to help the situation. These are the universities, institutions who have been working with us. I'm sure that with time, maybe the Howard Community College will be one of our collaborators. Because there are lots that we can do. We have Delta Airlines as our sponsor. For more than 10 years, they've been sponsoring Breast Care International to go to the outreach programs and to the communities, and also to support the work that we do. So we are so grateful to them. The Kick Cancer Out program. Direct Relief has been helping, and sometimes they send as big as 7 tons of donations that we share to clinics and hospitals in Ghana. We are so grateful. Kempinski Hotel is also our partner, and I know that next week Phil is going to take the Links ladies to go and stay in Bisbee, make sure that they get the best yes. Students have been coming to us. University of Pennsylvania has been sending master's students, physics, medical physics, and we see Professor Stephen every year. The time they came, I think in 2024, they met Mariko and the daughter during their visit. And Northeastern University has also been coming with the students, and we are always happy to receive the students. Students from Boston University also have been visiting. The University of Groningen in the Netherlands, and also from Rotterdam, also been coming. Loma Linda University has also been sending students from California. And we are thinking of how to use the VR set in breast cancer management. It's always stressful when the woman is going for biopsy. It's always stressful when the woman is yet to receive the diagnosis of cancer. And so can we use the VR set to reduce the stress that these women go through? It already is being used in medical healthcare practices to treat severe burns of children who have received extensive burns without using the opioids. So we believe that we can use the VR set in breast cancer management. And this is last year, we can see Nikki during the work that we have. We want every woman battling with breast cancer to survive. And we are lucky to have brave breast cancer survivors who have come out. It's a session of the women who came for the work last year. We are always grateful. Thank you, Ricky and Touch. I also want to send a royal thank you to the King of the Ashanti Kingdom, the King of Zeta to the second. What we are saying is that where a person lives should not determine whether he or she should survive or die from cancer. Let's all play our part in this endeavor. There is a lot we can do, and together we can defeat cancer. Thank you. Yes.
The young generation to understand the relevance of early detection, the research, the treatment, and the survivorship, and how that can relate to the older generation who are going through those things.
Yes. I think we, the older generation, should first acknowledge the fact that the young ones have a lot to do when it comes to creating awareness and educating the people. Even to educate the young ones, you cannot use the regular platforms, the TV and the radio. They don't listen, they don't watch, but we know where we can find them. Those platforms, TikTok, those areas. In fact, a lady we did surgery for last month. Just this morning, I heard that the partner had beaten her to death. And some people thought it's the cancer that killed her. It wasn't the cancer. But the partner was cheating. So the friend took her to the house to go and confront the partner. And the partner beat her. So she became unconscious. He took her to the university hospital, but she was brought in dead. This death, we got to know on TikTok. We didn't even know that she was an influencer, but because of her activity on TikTok, it came out that she had her surgery just a few weeks ago. And everybody thought it was the cancer. It's not the cancer that killed him. So we need to find where we will get them. And the children are very passionate. When we go out and we are talking and you see some women, girls shedding tears, we call them, and the tears are because the grandmother died from breast cancer, the mother died from breast cancer. So they are very passionate. And so we believe that training them, giving them the knowledge, we can't train them to be doctors, but at least the basic information that they can share with their friends on those platforms they are. And also help them to know their bodies. They should also be checking their bodies. In a situation where we don't have screening systems, they have to check their own breasts, because majority of the people report to the hospital when they themselves have found a lesion. So they should understand that they shouldn't be shy. The breast is such an organ, very beautiful, and a lot of the young ones especially want to show the breast. Those who don't have them, they want to have big ones, and they do extra, they go the extra mile to have the big ones. I was telling the Liz team that I arrived on a Thursday in California, and Friday I was in theater, the Beverly Hills, where Dr. Obeng was doing surgeries there. He's a plastic surgeon. So young people appreciate their bodies. And so when we talk about their breasts to them, they are so interested. The disease is affecting young ones. And we have 13 years, we have 14, we have 18-year-olds, 20s. And so these young ones should not see the disease as a disease of the older generation. The young ones are getting the disease, but because they are young, sometimes they feel it's for their mothers, it's for their grandmothers. But when we involve them, it makes them understand that no, they are also involved. And sometimes when their friends are also diagnosed, they rush to the hospital, they want to be checked. So let's see how we can involve the young ones. They will help us to have a better future. And they have a big role to play when they take the information on their platform, where sometimes they have millions of people watching those things they put out there. One of them was saying, they are not serious. They want to talk about non-serious matters. So they don't have time to sit and listen to the serious ones. But we can give them the teasers so that they can share on those platforms, and it will help them to have a better future. Thank you.
My other comment is about your Young Masters program and peer navigation training and workshops that you have for the students. Just in here might be interested.
Yeah. Thank you. That is a project that we selected certain senior high schools. And so we picked 10 senior high school students, girls, and a teacher, a female teacher, to join them. So we trained 100 students, and it was a pilot project which was sponsored by AstraZeneca, and hoping to expand it. We haven't yet had the finances to do the main one or a bigger one. But that is the way we can involve the youth to get them also educated and also be part of the drive to make sure that their mothers and grandmothers are not dying prematurely and needlessly, because sometimes the woman dies when she's not supposed to die. If she had just taken the effort to go to the hospital, maybe her life would have been saved. But a lot of them are in the prayer camps. They are going for prayers. They're going for spiritual healing first before they go to the hospital. And so the pastors also, we need to work with them and tell them that tell your woman to go to the hospital whilst you pray for her. But we are not there yet, but I'm sure that with time, at least by the time our children and our grandchildren will be adults, things will not be the same.
I'm gonna show you guys on, here's the kids that we're here today with. Gonna wave and say from Facebook Live. We're at Howard County Community College, right? With National Council of Negro Women. The doctor is in. Oh, we do? Okay, great.
So my grandmother passed away from breast cancer when she was 58. My mom was 40 and I was 20. I'm now 38. So I'm constantly like, I have that like PTSD in my mind, like something's gonna happen. When my grandmother passed away, she kept having a cough. And my dad kept telling her, like, and this is my mom's mom, he kept saying, you need to go to the hospital, get it looked at. She had many scans. They told her it's not cancer, it might be pneumonia, it's not cancer. She got a second opinion, same thing, they kept declining it. My dad kept saying, like, something just doesn't seem right to me, she should have it looked at. They kept declining it over and over again. Then she got a third opinion and they said it was breast cancer and it had spread to her lungs. And they kept pushing it off. My mother-in-law, who's white, had a biopsy done, and within 2 hours, she knew that it was not cancer. So like that difference to me really stands out. And it makes me wonder when there's kids in these like local villages from the images that you shared with us, and they come with like really big tumors, how long does it take for it to become that large where they're like, okay, I need to see someone, versus when it's, you know, they don't even know that they have it? How long is that time frame? And then how do you support someone in a localized village where there isn't that support system that you would have in like America potentially?
Yes, so let me start from your second question. We always need to support women, especially those in the communities. Transportation money, there are a lot of single mothers, and so for her to go to the hospital with a disease that is not painful, mind you, breast cancer is not painful at the beginning. So they don't see why they should waste that money on transportation. So if we go out, we see a woman, we follow up. And that's why we have some sponsors like Delta Airlines, we have Teva Pharmaceuticals, Kempinski Hotel, and they support some of the activities that we do. Difficult diagnosis, it's everywhere. Because sometimes the disease will not show like the typical way, you know. And for you to say that, okay, this cancer will reach a stage 4 within a month or 2 is very difficult. There are several subtypes of breast cancer. So if it's an aggressive tumor, then within months already, there's metastasis. But somebody can stay with a tumor for 5 years, and it's nowhere. It's just a locally advanced tumor. So we cannot compare. Depends on whatever tumor the woman has. And that's why pathology is very important. In fact, that is the golden diagnostic tool, to have a tissue diagnosis. Mammography, ultrasound, they will tell you there's something. Ultrasound will tell you it's solid or liquid or fluid, and it's not much, but the biopsy will give you the diagnosis. So it's always important to go to the core. Even if the first doctor said we are not seeing anything, go to another doctor. It's always important to have a second or third opinion, and also to know your body. Your body will be telling you there's something wrong because you know your body. Now something is not adding up. Don't accept no for an answer until you've gone to the bottom. And because we know of people who were diagnosed when there was already brain metastasis. And in some metastatic conditions, it's very difficult. There's not much you can do. So once you have you are lucky here. In fact, you are lucky, and I get surprised how a woman can say and present with an advanced stage breast cancer. Hey, when you have mammograph machines, screening mammography, they are calling you, they are sending you messages, and you still say, I'm busy, I didn't go. Why? But that is a woman for you. We sometimes pay attention to things that are not important. If you go to the salon and you sit down to listen to the conversations, you realize that we are not serious. But for a disease like breast cancer, we should get serious. Because when the young woman dies, it's the children who suffer and their future. We have a group called Survivor Babies, those who lost the battle and those who are still alive and their children. And Breast Care International has to pay school fees every year. Otherwise, they will drop out of school. So the woman has to stay and look after her children and the family. So we don't have to take things for granted. It's true, we can even misdiagnose the disease, but don't take no for an answer, especially when you yourself, you've seen something. But the woman in Africa, when she's going to the hospital from the house, she'll be telling herself, let them say it's nothing, you know. So when she comes and unfortunately she hears it's nothing, then she goes to sleep. But we advise our women, don't take the no until you've gone to the root of the problem. And for you, you need to be going for the genetic test. It's very important. You have it. We cannot do it for our people because it's expensive. They don't have the money. So if it's not research, there's no way we can do that. But we know that women who are less than 50 years, who are triple negative, need genetic testing to know whether they are BRCA, they have any of the mutations. Maybe your mother, grandmother, or family brother had prostate, brother or father, uncle had prostate. Your mother or a relative had ovarian cancer. Somebody had stomach cancer, and then, or maybe pancreatic cancer. Such cancers has genetic connotation. So take advantage of what you have and go and get it done. And you can do bilateral mastectomy as a prophylactic one. Now we have Ghanaians who have started that. Those who have that strong family history, they are opting for that. And so let's take advantage of what we have.
I would say be the CEO of your own health.
Yeah.
And I'm 3 generations. I don't have any genetic mutations, but my daughter at 38 had a prophylactic mastectomy. She has 3 babies she didn't want to do. But you should be diligent because of your history. There you go. So it all counts.
Yeah.
So just be really diligent in your screening.
And you should go for a full profile.
Yeah, you should. Yeah. We can help you. Just,
It's very interesting. Last semester, I took this class, Dementia Healthcare, and we studied the cancer. And we talked about October with Breast Cancer Awareness Month. And you got all these advertising going on, and all these corporations that's taking advantage of that opportunity. You got nail polish, you got all this stuff going on. But what is happening is they don't even support the funding in order to get testing done. Free mammograms, like you were saying. And so we have to be very careful. That was an advertisement, even Kentucky Fried Chicken, with a ribbon stamped on it, misinformation, saying if you eat Kentucky Fried Chicken, then therefore you don't get breast cancer. So we have to be aware. We have to be very cognizant of what it is that we're being told, we're seeing, and then we need to support other women. It looked at also about some women were saying they didn't like the frills and the balloons and all of this going on because they have breast cancer. So what is there to be happy about? So you're getting 2 opinions. But I was glad to, I think I even asked Ms. Deb, I said, with breast cancer awareness, and I told me why they're doing it now. But then now I see the importance of it because it should be something that should be done every month, basically, if you really think about it.
October's like Black History, like Black History Month.
Everybody
Black on March 1st.
Yeah, jump in on it and what have you. And at our church, I'm pastor's wife. We always have a program for our church and invite the community in every October. But like I said, those are just some things that we just really hone in on. That just be careful about the misinformation that's out here about this, and try to do as much as you can to get tested, to do your self-breast exams and what have you. But this is very informative, and I thank you for coming out, both of you, for sharing with us today.
Thank you
Yeah,
so much.
thank you.
I call them the mushroom organizations.
Yes.
In October, they just spread
Right,
mushrooms. After
Right.
October, they all go to sleep.
right,
But breast cancer doesn't strike
No.
only in October. Every day,
every day,
every day,
Every day,
someone
every day,
needs
every
the
minute.
education. So let's make it a daily event,
Yes.
not a yearly
Yes.
event. And the misinformation is very important.
Yeah.
Otherwise, I mean, in Ghana, it's also there. Sometimes in October, you hear the men going on TikTok and all those things that women should allow the men to suck their breast, so they will suck the cancer out. Oh, wait a minute. Yes. So I asked them, what are you saying? So you have a daughter. Will you send your daughter to the streets that go and get a man to suck cancer out of her breast? So we need to just see where they are joking and when they are serious, because I see that as a joke.
Yes.
Yeah,
My name is Nyla. I work with the Rise Group. So my question is, I lost my mother. She was 36 with breast cancer. She got diagnosed at 32. So when I became 22, I did the genetic testing. I go to a breast specialist regularly. Have to take those precautionary measures, even though the mammogram is 40, I had to start 20 years. We talk a lot about misinformation, and then you also shared with us today that the science isn't always based on our bodies. So what are some lifestyle changes that you would suggest to the women in this room to make to not me being high risk and to those not knowing if they're high risk or beyond just within our community? What lifestyle suggestions do you all have for us to make sure that, we're taking care of ourselves beyond just going to the doctor?
Okay, so we did a study in Ghana, the Ghana Breast Health Study. It was an NCI-NIH project. And we came out with our risk factors. And in the Black woman, because those Black Americans, you all came from us, okay? You have the same root. So, yes. So alcohol is a big risk. Cigarette smoking. And we have a huge problem now, shisha. Shisha is cigarette. And we've realized that 1 puff of shisha is equal to 10 sticks of cigarettes. And the young ones are the ones patronizing.
hookah.
No, the one with the pipe.
Yeah, hookah.
It's not vaping.
No, it's not vaping, it's hookah, hookah.
I call it shisha.
Yeah,
So
yeah, vaping's also.
any form of cigarettes is not good. Diet. So we are part of the International Breast Cancer and Nutrition Project, where we are looking at fat especially, and the role it plays in breast cancer development. We don't know the exact cause of breast cancer, so we cannot do primary prevention. But all the other preventive measures are secondary prevention. So you make sure that you don't take in a lot of fats, because when mice were fed on fats, majority of them developed breast cancer. And we are all mammals, don't forget. So it's not yet proven to be among human beings, but we can realize that it may have some link. The environment. And now we are looking at a lot of pollution from the environment, the pesticides, and all those things that we have. Ours is serious. The illegal mining, that is another big thing that we are facing now. So all those things that pollute the air, the soil, the water, and the food, it's also of importance. Another thing that came out was the use of skin lightening agents. And that is for us, the Blacks. So these agents, a lot of carcinogens are found in the agents. So we need to be careful. Some are injections, some are tablets, some are creams, some are soaps. And so women who use those products should be careful. And also the skin lightening agents also came out as a risk factor. But those are not the causes of the disease. And those who have positive family history should understand that about 10% of all breast cancer patients have a positive family history. 10%. So 90% are those who do not have any history, and the majority. But if you have a history, at least you have something you can work towards. And so you start checking early and doing maybe not a mammogram, but an MRI. MRI is better for even dense breasts than mammogram. So those things that you have as an advantage, make good use of them. But we are not here to scare anybody. The fact that your mom or grandmom died of breast cancer doesn't mean you are also going to die. No.
Thank you.
But early detection is
The
critical.
key.
Check your breast.
Yeah.
Check your breast, check your breast.
We add prompt action because we can procrastinate a lot. So you found something. Instead of you going to the hospital, oh, I'll go next month. Oh, I have a wedding to attend. Oh, I have a funeral. So we are never ready for ourselves. And so in that case, it wouldn't be important that you found it. So you find anything, take prompt action. That is when it can save the life.
Yeah.
Yes.
I have a quick question. So you said if you find anything, we're always told to look for a lump and breast.
There's all
tissue
kinds.
always feels lumpy, especially around your, like, what do you know what to look for? Like, how do you know?
Okay. So the breast, whatever came, when you started, maybe it started coming burden at age 10 or 9, this time, even sometimes 7-year-old, and the mother is worried that, oh, the breast is coming. There's early development. So what came is your breast. If a woman will be checking regularly, you know the type of breast you have, how they look like when you stand in front of the mirror. Most of you, we stand in front of the mirror, we don't look at the breast, we look here, look at the face, and you are gone. But we want our women to start checking. Look at your breast, see which one is bigger than the other, because every woman has one breast bigger than the other. You should know whether it's your left or your right. Then when you feel them, every woman's breast is different. So it could be lumpy, it could be soft. Sometimes the woman has not even delivered before, but the breast is flat. That's the nature. And some people too, they've had 3, 4, 5 kids, and they still have that nice standing ones. So that is the nature, but you should know yours. And we don't examine our breasts before your menses. Most women have changes in their breast before their menses. So before the menses, your breast will be tender, you touch and it's a bit lumpy. After your menses, it becomes softer. It becomes less tender. So that is the time you have to check your breast.
So breastfeeding, so sometimes they're different.
No. Don't use that excuse. Right after the baby has finished or you've expelled, the breast becomes soft. So check them at that time. If you wait when it's engorged, you won't find anything. So after you've expelled the milk, check it to know how they feel like. Okay.
Thank you.
Can I ask one question from Dr. Mo, my co-host? She said, how can we from the US help you in Ghana?
Hey.
Beautiful question.
Say thank
Dr.
you
Mo.
to
Dr. Mo.
Oh,
Yeah.
okay. Thank you. A lot. I mentioned that we have to go to the communities. We have to travel to the villages. The other time, Dr. Johnson came to us in Ghana. She gave us an envelope. It has gone to a village and camp. And so the women who are there. We don't expect them to fuel us to come to them. So we have to fuel ourselves. We have to go and send a team to go and educate and screen them. So we have a lot of activities that we do. Those who do not have money to even think of buying something, no, traveling, using it for transportation. Sometimes we send them Momo so that they can travel to the city, because all the treatment centers are in the cities. So we need to help them to come. If even you are saying you should come for free treatment, you have to help them to travel. We don't have any social support systems. It's not like here that you can find Office of Touch, you can find Susan G. Comey somewhere, or NCN group somewhere. We don't have that. So we are always available to help. And so they send messages, these TikTok things and all the messages that they are sending. I know this woman, then they will send a picture. So if you see the picture, you can't say no. You just say, okay, bring the person and let's see what we can do. So there's a lot we can do. And also training of manpower, training the doctors, the nurses in the communities.
Dr. Mo said, thank you. I love you, Dr. Beatrice.
I love it too.
I'm gonna
Thank you.
close
Yeah.
out my show.
We
So,
still need a lot to do. That's
Yes. A lot to do. The doctor is in. See you next week. We hope this was relatable, reliable, and real.
Beatrice for being here with us today.